Good evening, ladies and gentlemen. Welcome to our special COVID-19 virtual town hall meeting. I'm Tammy Dana-Bashan, Mayor of the City of Rowlett. I have with me City Manager Brian Funderburk, Emergency Manager Coordinator Ed Balderas, Garland Health Authority Public Health Manager Diana Beeler, and Denise Perrin, our Community Relations Manager. During this town hall meeting, we will be providing up-to-the-minute information, and we will also be taking your questions. As you have a question, please type it in the comments, and Denise will monitor these questions as we proceed through this town hall meeting. If your question is not covered by our prepared remarks, we will try our best to answer your questions after our prepared remarks. Please know that this is a very fluid situation, and we are doing our best to provide you the most up-to-date information. We have a lot to cover, so I'd like to get right to it. We're going to do this in a Q&A format to begin with, so we make sure we cover all the information. So the first thing I'd like us to cover, and Ed, a lot of these questions will be directed to you. Could you please help our viewers know what's our current situation in our country, our state, Dallas County, Rockwall County, City of Rowlett, in regards to the number of cases and the number of deaths?
Yes, as of this afternoon, there are nationally a little bit over 3,779 cases and about 57 deaths. In Texas, we've seen 71 cases, 19 of them in Dallas County. As of this afternoon, there are no persons being investigated or monitored for COVID-19, and nor have we received any positive cases. In addition, in Dallas County, there have been 2 confirmed cases of community spread.
Okay, thank you very much. So how will we know if and when someone living in Rowlett has been confirmed as having COVID-19?
Well, if we do receive a positive case, the health authorities, both Dallas County, Garland Health, or Rockwall County, would notify the mayor first and any other selected officials that there is a case or somebody being monitored for COVID-19 in Rowlett.
And our commitment to our residents in regards to communicating to our public if we do have a case. Brian, do you want to handle that?
Sure. The CDC has revised its previous guidelines.
Hang on.
Sorry.
No, I'm talking about if we have a case in Rowlett.
Yes.
We are committed to being transparent with our community, and we will publish that as soon as we possibly can.
Yes.
And we will stay very, discreet in regards to the information we provide. We will provide the information as allowed by HIPAA laws. So we will maintain that discretion, but we will communicate with our public. Correct, Ed?
Yes.
Okay. I'll go ahead and ask Ed to give us the most recent CDC guidance. So the CDC came out with some revised guidance today and last night. So could you please provide the public with the most recent CDC guidance?
The most recent and most significant is that the CDC is recommending that any gathering with 10 or more people not be held. As yesterday, that guidance was 50, so we are seeing significant increases in that guidance. Events of any size should only be continued if they can be carried out with adherence to guidelines for protecting vulnerable populations, securing hand hygiene, and social distancing. When feasible, organizers could modify events to be virtual.
And what's important to know about that is guidance at this point in time. That is not a directive. We're going to talk about directives and orders, and we're going to talk about guidance, and we're going to talk about practices. That is the most recent CDC guidance.
Yes.
Is that correct? Okay. I want to talk about our local disaster declaration and what that means. Last Friday, the City of Rowlett joined Dallas County, and I issued a disaster declaration for a public health emergency. Because of the risk of rapid spread of COVID-19 and the need to protect our most vulnerable members of the community, this order last Friday prohibited community gatherings of 500 persons or more anywhere in Dallas County beginning at 11 a.m. on March 13th. That was last Friday. And continuing 7 days through 11 a.m. on March 20th, which is this Friday. Again, this is the order, the disaster declaration that was issued last week by Dallas County, and I mirrored that disaster declaration for the city of Rowlett. It also recommended groups of 250 not meet, recommended not meet, and that those individuals at risk should not congregate in groups of more than 10. Today, very recently, Dallas County amended their order to prohibit community gatherings of 50 persons or more. Community gatherings include indoor or outdoor events in a single room or other single confined or enclosed space, such as an auditorium, a theater, a stadium, an arena or event center, a gym, a meeting hall, or conference center. Further, Dallas County's amended order late this afternoon mandates that restaurants with or without drive-in or drive-through services and microbreweries, microdistilleries, or wineries may only provide takeout, delivery, or drive-through services. That means no in-house dining. Additionally, bars, lounges, taverns, arcades, and private clubs shall close. Additionally, the health authority strongly urges individuals to cancel, reschedule, or not attend social gatherings that have or will likely have 10 or more people. The Dallas County order further states, if someone in a household has tested positive for coronavirus, the household is ordered to isolate at home. Members of the household cannot go to work, school, or other community function. Additionally, nursing homes, retirement facilities, and long-term care facilities are instructed to prohibit non-essential visitors from accessing their facilities unless to provide critical assistance or for end-of-life visitation. This Dallas County order is effective at 11:59 p.m. tonight, March 16th. The City of Rowlett, just moments ago, amended our citywide order to comply with Dallas County's amended order. What that means is all of those provisions in the Dallas County order that was signed late this afternoon are applicable not only to the Dallas County portion of the City of Rowlett, but are also applicable to the Rockwall County portion of the City of Rowlett. I have amended my order to mirror, I have amended my city order to mirror the county order. And that city order should be accessible after the meeting for the exact wording. We will consider, the City of Rowlett will consider an extension of this order past the March 20th date at tomorrow night's council meeting. So how this works is the mayor is allowed to do this for a 7-day period. The county judge is allowed to do this for a 7-day period, and then they must obtain authorization from their governing body, in our case the city council, in the case of the county, the commissioner's court, in order to extend that order past the 7 days. And I'm looking at Ed to make sure I'm not saying anything incorrectly.
That's correct.
Thank you, Ed. Again, the amended order will be effective at 11:59 for the City of Rowlett tonight. What this specifically means to some areas in the City of Rowlett are we will be closing the Rowlett Community Center. We will be closing the Rowlett Public Library. We will be closing Kids Kingdom, specifically Kids Kingdom, because that park is enclosed in a fence and likely has more than 50 individuals within that fenced-in area. So that meets the definition of the Dallas County order and the City of Rowlett order. Other parks will remain open. Please practice social distancing and hygiene at those other parks. In addition, all city athletic leagues will be postponed at this time. Certainly, any of the athletic activities that are occurring in the RCC are postponed because the RCC is closed, but we are also postponing outdoor athletic activities such as the baseball leagues and the hockey league. The soccer league is an independent league, and they had already postponed or canceled.
Mayor, I believe they canceled.
Okay, well, the soccer is making their own independent decision, and at a minimum, they postponed. So I will pause there and see if we have any other comments on the panel in regards to the Dallas County order and the City of Rowlett order. Diana, Ed, Brian?
And just so the public understands, tomorrow night at the City Council meeting, we will be discussing this issue. There may be some additional action the city feels comfortable taking at that point, but as of right now, to comply with the actual order, that includes the library and the RCC. Thank you, Mayor.
Thank you. And I want to make sure that everybody understands that this was a requirement to comply with the Dallas County order for the portion of Rowlett that falls within Dallas County. We believe that it was very prudent to extend this to the entire city of Rowlett for obvious reasons. But we had no choice in this matter. We must comply with this Dallas County order. It is extreme, but extreme measures are called for at this time. And we're going to talk more about that during this town hall meeting. So I'm going to move on to the state declaration. The state made a declaration on Friday, March 13th. So Ed, tell us a little bit about what that all means.
This past Friday, Governor Abbott issued a statewide declaration of disaster. This allows for state resources to become available for regional and local response. For example, personal protective equipment for our first responders. It also allows for certain state laws and regulations that may hinder our efficient response to this pandemic to be relaxed.
Okay. Thank you very much. And then there was a national declaration also last Friday, if you could talk about that a little bit.
So under the Stafford Act, the President afforded the ability to issue a national emergency declaration ahead of any state requesting assistance. This specific declaration allowed for $50 billion to be made available to help state and local governments to not only tackle the coronavirus pandemic, but also relax against some of the rules and regulations that may hinder our ability to respond efficiently. Again, this is made under the Stafford Act, a declaration that gives FEMA the authority to respond to the COVID-19 pandemic.
And now I'm going to move a little bit, change directions a little bit. I want to talk about our local health official and, why do we have somebody from Garland here? Diana, thank you so much for being here. What is the role? Who is our local health official? What is your role? And there were some directives and orders issued last week and then a revised today.
Yes.
So tell us all about that.
Okay. We're very fortunate to have Dr. Lambert to serve as our health authority for the City of Garland, Rowlett, and Sachse. He's able to, as a health authority, to issue health directives and health orders to help reduce the spread of COVID-19 in our community. These directives give direction to the general public, to those populations in high-risk categories, to long-term facilities, and those operating publicly occupied buildings in Garland, Rowlett, and Sachse. I'll touch briefly on a couple of the health orders that he's done. The health order he did for the long-term facilities was updated today, and he basically is limiting all non-essential visitors' access to facilities and long-term care facilities. Non-essential visitors will be given access for end of life, residents who are at their end of life, but they must adhere to the screening protocol. And staff and medical necessary people will also have to be screened to enter the facility. And that was updated today, and it's on the website. He also issued a health directive on the, which we already spoke about, the assemblies, large mass gatherings, and we are following the CDC guidelines on that. He also ordered the directive for people that are sick. If they have a fever and respiratory symptoms, they need to stay home and self-isolate and not go to work if they're sick. And he also issued a directive on posting signs for people to be reminded to practice protective measures, and the signs are supposed to be posted at the front of the buildings.
And this will change tomorrow.
Yeah.
I mean, it is a very fluid situation. And,
Yes, it's very fluid.
You know, not only is the city of Rowlett and Dallas County, but our public health authority is keeping very much up to date.
Yes.
And communicating with us, and will continue to communicate with the
Yes.
public.
All these directives and health orders are posted on the Garland webpage.
Thank you.
Mhm.
So Ed, talk to us a little bit about what preventative measures Baylor Scott and White at Lake Point is taking right now, if you would.
So beginning today, visitors and patients will use designated entrances and will be screened upon arrival. This screening is based on CDC guidelines for identifying respiratory illnesses, including COVID-19. Patients will continue to be screened at registration, and only 2 visitors will be allowed per patient and no visitors under the age of 16. In addition to that, waiting rooms have been closed to any large groups.
Okay. And we're going to talk about processes and procedures to do for sick people, but I just wanted to make sure everybody understood what Baylor is screening for. So let's move into the actual COVID-19 and talk about that some more. What are the common symptoms of COVID-19? What are the emergency warning signs of COVID-19? How do we help people know what to do?
So some of the common symptoms associated with COVID-19 include fever, cough, and shortness of breath. I know a big concern is how do you know when you need to seek immediate emergency care for symptoms? We have 4 symptoms that are emergency warning signs for COVID-19. Those include difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to awaken, or bluish lips or face. So if you do show any of those symptoms and you are self-isolating, self-quarantining at home, we do encourage you to go ahead and seek emergency medical care. Do not be afraid to call 911 if you are showing any of those symptoms.
But tell them your symptoms.
Right, so either,
So what should people do? You feel feverish, so what are the steps?
right, so if you do feel any of the common symptoms, you should call your primary care physician, and they will notify you of what appropriate steps you need to take. However, if you do decide or you are told to self-quarantine at home and self-care, we do want you to be aware of when that point is where you need to seek additional emergency care. And again, I'll repeat those. Difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to awaken, or bluish lips or face.
Okay. Thank you, Ed. So let's talk a little bit about testing for COVID-19. When's it appropriate to get tested? How do you get tested? What's going on with testing in our immediate area? If you could get into that some.
So testing criteria includes individuals and healthcare workers who are showing symptoms. They are symptomatic, and also individuals with certain risk factors. That includes exposure to potentially other people with COVID-19. Individuals who have traveled to a location with ongoing coronavirus cases is also a high risk, and the individuals who are hospitalized with COVID-19 symptoms. Testing won't be performed on people who are not symptomatic. Texas Public Health Labs have the capacity to test about 270 people per day, and that number is increasing. Currently, we are expecting in the North Texas region to be able to do roughly 5,000 tests per week. The first drive-through testing site opened in Texas on Friday in San Antonio. We did have another location open off Parkland Hospital today at noon, and we'll have 2 additional sites in DFW hopefully by the end of the week.
And Ed, I think you talked to me about that there's a phone number to call. Is that something you want to cover now?
Yes, I don't have that phone number on me, but
We'll
I
look
can.
it up as we talk. And when you get that, tell them when they should call that phone number.
Okay.
And
So if you are concerned that you may have been exposed to COVID-19, somebody who has that disease, we encourage you not to go directly to your healthcare provider or an ER. Instead, call that number so you can go through a proper screening process so that it can be determined whether or not you should have a test performed. Again, these tests are limited in number, and we want to make sure that only those people who are at higher risk are receiving those tests.
okay. While you're looking for that, and we'll come back to that, I'm going to talk about how, methods to protect yourself from contracting COVID-19. I know a lot of people have heard this. I'm just going to say it again because we're not going to go through this town hall meeting without talking about this either. Wash your hands often with soap and water for at least 20 seconds, especially after touching any surfaces, going to the bathroom, before you're eating, after blowing your nose, after coughing, after sneezing. If soap or water are not available, use an alcohol-based sanitizer with at least 60% alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you're sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash immediately. And clean and disinfect frequently touched objects and surfaces using a regular household cleaner, spray, or wipe. One of the good things is that regular cleaners can get rid of this on surfaces. It's not, what's the word I'm trying to say? Regular cleaners can get rid of this as the good news about this. So,
Yeah, so as long as it's an EPA registered virusicide, it can kill this.
Yeah, thank
that
you.
virus.
All right, do you have that phone number?
Yes, that phone number is 214-590-8060. Again, that's 214-590-8060.
And use that phone number if you suspect that you have COVID-19 and that you might need to be tested.
Yes.
Is that the right way to say that? Okay. So I want to talk now about, you hear a lot about at-risk individuals. So let's talk about who are those at-risk individuals and how do they differ from the rest of the population?
So I'll let
Diana?
I can touch on that. Those who are most at risk, and what should they do to prevent infection? The at-risk populations include people who are over 60 and have certain health conditions such as heart disease, lung disease, diabetes, kidney disease, and weakened immune systems. All at-risk populations should limit interactions and contact with those others to the greatest extent possible. Take extra measures to put distance between yourself and other people to further reduce your risk of being exposed to this virus. Stay home as much as possible, have supplies on hand, and take every day to precautions as we have discussed here.
Thank you. And I have heard that, it's still good to get, if you haven't had a flu shot, go get a flu shot.
Yes, we still have flu shots available.
And that's still a good thing to do. And pneumonia,
Yes, their
So-
pneumonia shots are available.
pneumonia shots are available, and that's a good thing to do.
Yes.
Okay. Anything else that is in that area?
Just isolating yourself and avoid the mass gatherings.
But there is no vaccine for COVID-19.
No.
So, okay, another term that we've heard a lot about is social distancing. So, can you explain what social distancing is and how do you practice that?
Social distancing is a way for us to reduce the spread of COVID-19. It refers specifically to the practice of deliberately increasing the physical space between people to avoid spreading illness. As you can see with the tables, we do have identified at least 3 feet separation between ourselves to ensure that there's proper space. This is to avoid spreading the illness. The recommended 3 to 6 feet away from people lessens your chances of catching COVID-19. Canceling events that are likely to draw crowds is an example of social distancing, as is working from home instead of at an office, closing schools or switching to online classes, visiting loved ones by electronic devices instead of in person, and canceling or postponing conferences and other large meetings.
Okay. And then another term, you used it earlier, I want to make sure we define, is what is community spread? Do we have community spread in Rowlett, Dallas County, Rockwall County? And why do we care if we have community spread?
So community spread refers to instances of confirmed COVID-19 in a defined area where people who have been infected do not know how they or where they were exposed. Essentially, that means that it's not a travel-related case of COVID-19. Community spread has occurred in Dallas. We don't have a case in Rowlett. We have 2 cases of community spread COVID-19 in Dallas County, and we have certain other counties in the state of Texas with the same issue.
And there's other cases that are currently being monitored that might be additional
Yes.
in
That was
Dallas County.
announced today, yes.
Yes. One of the most, I think, shared social media posts has been the flattening the curve graphic, which is really a good graphic, explains a lot. But can you expand on that? What is the flattening the curve? Why is it so important? Why are we doing what we're doing right now in this country, in this state, in this county, in this city? And why is it so important to our healthcare system?
Well, we have a very robust healthcare system. When we're dealing with low numbers of COVID-19 patients, our healthcare system is very good at treating those patients. However, when we start receiving surge capacity, that's where we start seeing partial failures of that very robust system. So flattening the curve really refers to sort of slowing down the spread of the virus to allow our healthcare system to catch up and continue to provide care on a long-term basis. The recommendation is that we all increase our use of certain non-pharmaceutical interventions, including social distancing, so there's not a huge spike in the number of people getting sick all at once. If that were to happen, there wouldn't be enough hospital beds, doctors, nor mechanical ventilators for everyone who needs them. The U.S. hospital system would simply be overwhelmed. So not only are you considering the increased COVID-19 cases, but also just your normal day-to-day stress on the healthcare system.
Okay. And we hear about self-quarantining and isolating. So let's talk first about self-quarantining and why do you do that and for how long?
Right. So if you do believe you've been exposed or you're a high-risk individual to have COVID-19, self-quarantining is a practice that allows you to sort of isolate yourself from others in order to help reduce the spread of COVID-19. Health experts recommend that self-quarantine lasts about 14 days. That's due to the incubation period that has been observed with COVID-19. 2 weeks provides enough time for you to know whether or not you will become infected and be contagious to other people. So self-quarantine involves using standard hygiene and washing hands frequently, not sharing things like towels and utensils, staying at home and not having visitors, and staying at least 6 feet away from other people in the household. Once your quarantine period has ended, if you do not have symptoms, follow your doctor's instructions on how to return to your normal routine.
Which is different from isolation if you're sick. If you're sick, you need to isolate yourself in your home unless you have some of those emergency symptoms. But so obviously the Dallas County order and the City of Rowlett order changed things this afternoon requiring your whole household to stay in your house if there's someone in your household that is sick. So help us understand, how is it best to take care of someone in your household that's sick to try to prevent the spread within your household?
If possible, dedicate a specific room for that individual who does have COVID-19. Again, don't share things like utensils and plates. Try to limit your exposure in any way possible. And just practice that social distancing, making sure you're washing your hands, you're using proper hygiene.
And separate your bathrooms if you can.
Yes, ideally, that individual should have their own bathroom.
Okay. All right. So I'm going to shift gears again, and let's talk a little bit about what are we doing here locally in Rowlett to help our residents get through this period of time.
So a little bit over 4 years ago, our community dealt with EF4 tornado that really brought the community together. We, as a city, could not respond to that by ourselves. So as a community, we developed a long-term recovery committee in order to provide long-term sustained assistance to tornado survivors. That was a very successful program, which we also brought back to a smaller scale after Hurricane Harvey. Shortly before this pandemic, just good timing, I guess.
Not even knowing that this was about to happen.
Right. We started the process of formalizing this in the long term. So we had the ad hoc creation of the long-term recovery committee. We wanted to have something in place for the long term, something in place before the next disaster hit. So with that, we were to present to council formalizing the creation of a community organizations active in disaster group for the city of Rowlett. Currently, we did start that process a little bit earlier under the direction of the mayor in order to be able to more effectively respond to this disaster. Right now, the Rowlett Ready group is focusing on 3 fronts. The first being finalizing the plans to officially start the Rowlett Ready COAD. Tomorrow night at council, council will be meeting to be presented with the proposed framework for this group and ask for their input and sanction. Concurrently, we're also looking at the needs of the community today. There has been an increase in food distribution throughout our local food banks, so we are considering how we can assist those organizations. Finally, we are brainstorming about how we can help our senior population during this time. We hope that all of our neighbors are checking in with the seniors in their neighborhoods and family, but we are also concerned about the senior population that does not have family in town. We hope to have a website up by the end of the week. Believe it should be up by noon Wednesday, where neighbors can connect with resources and information. That website is rowlettready.com. You'll be able to donate cash, but also sign up to volunteer your time to help us not only catalog, organize, and distribute resources, but just make a good impact on any impacted neighbors. Just keep in mind that some of those volunteer assignments may require screening or background checks to complete the assignments, but we want to encourage everybody to at least sign up.
And, you know, it was a really great thing that we were working to form that as a permanent organization. It was unfortunate, the timing, that we didn't have it totally in place, but thank goodness we had it to the extent we had it, that we were able to act very quickly with this. So thank you to you and to many within this community that are working very hard on that. So I wanted to touch briefly on what's going on at the grocery stores. You know, many stores are experiencing bare shelves and a lot of hoarding of items. So what the stores have announced, and I'm not going to announce specific stores and specific hours because everybody's a little bit different and it can change every day. But please make sure that you're aware of what hours the grocery stores are open. Several major chains have announced that they're going to, you know, reduce their hours so that they can spend time overnight sanitizing their facilities and restocking their shelves. So very, very important step for our food supplies to be able to do that so people feel comfortable going into those stores. And I would just make this plea, and there's been pleas by many, but make this plea to the entire community is please do not hoard supplies. Please buy what you need, and you know, make sure that we are considering our entire community and their needs when we go to the store. We're not shutting down grocery stores. We're not shutting down the food chain in this country. So there's really no need to do that, and we need to make sure that we are making decisions for the community as a whole. So please do that. I'm going to ask Brian, why don't you give us an update on what the current information is on schools? And again, this changes and is very fluid.
Thank you, Mayor. The Garland Independent School District has closed indefinitely. They will reevaluate on April the 3rd. The Rockwall Independent School District is closed through Friday, March 20th. Some of these entities extended their spring break for a week, but I think with, as the mayor indicated, with this fluid situation, it's very dynamic, and so some of these decisions could change in short order.
And I think the Garland ISD decision was revised late this afternoon. Is that correct? Yeah.
Yes.
Yeah. Okay.
Indefinitely. Yes,
Okay.
ma'am.
And then why don't you give us the details on what's going on for meals for kids through our school system?
So what the school district is doing, GISD, is providing curbside breakfast and lunch. Breakfast is 8 to 9, and lunch is from noon to 1 this week at designated campuses. In Rowlett, these include Back, Dorsey, Giddens Stedman, Liberty Grove, Rowlett Elementary Schools, and Coyle Middle School. Families may remain in their car. One meal will be provided for each child who is present and under 19 years of age. Additional locations can be found at garlandisd.net. Rockwall ISD is offering curbside lunch this week as well from 11 to 1 p.m. at Dobbs Elementary and Rochelle Elementary. Both of those are in the city of Rockwall.
Thank you, Brian. And then if you could, Brian, tell us the status of the Rowlett Court and help people understand what they should do if they believe they have an upcoming court hearing.
So at the recommendation of the Texas Office of Court Administration, the Rowlett Municipal Court has postponed all remaining court dockets through April 3rd. If you had a court date scheduled during this time period, you will be notified by mail or electronic communication when your court date has been rescheduled. Please contact the court office at 972-412-6222 or court@rowlett.com if you have any questions.
Okay, thank you so much. And Brian, further, can you explain what Connect Rowlett is, why it is important right now, and how residents can sign up?
So Connect Rowlett is an app that we use to help communicate with people, particularly during an emergency. We encourage you to sign up or register your contact information with Connect Rowlett, the city's emergency notification service. Connect Rowlett allows residents to opt in and receive information via phone call, text message, or email based on locations and subjects relevant to you. This system is used to notify residents of imminent threats to health and safety, as well as informational notifications that affect home or work environments, such as severe weather, flooding, gas leaks, police activity, and more. If you haven't already, please register as soon as this town hall concludes at Connect Rowlett.
And that system just works so well. I get text notifications, as do a lot of people in the community, every time there's a storm that Ed keeps us very safe from, and we appreciate so much what you do day in and day out for our community. Ed, how would you foresee utilizing Connect Rowlett in regards to COVID-19 event that's occurring right now?
If there was any need to communicate a emergency situation regarding the COVID-19 outbreak in the city, that includes any possible closures of city facilities or certain areas, we would use that system to provide that near instantaneous notification. So instead of relying on information that may not be accurate, this is a way for you to receive information directly from the city, either through, again, email, phone call, or text message.
Thank you. And, you talked a little bit, Ed, about that we'll have that website up probably Wednesday, but right now we're providing a lot of information on rowlett.com. Is that correct, Brian?
That's right, Mayor. We've created a web page at rowlett.com to share the latest information regarding the city's response and operations. In addition, we will post updates to our Facebook page. Please follow the CDC on social media or visit cdc.gov for factual information as well. This is, again, a dynamic situation. It's changing constantly. We would encourage you to seek and to share information with your family and your friends, but make sure that you're checking cdc.com, cdc.gov, and then also rowlett.com.
Thank you. And before I go to Denise to get questions, I want to go back over again what specifically the new Dallas County order means and what the City of Rowlett order means. I know I covered it once in this phone call. I want to make sure, in this town hall meeting. I want to make sure that everybody understands exactly what this means, because this is new information late this afternoon. Before I do that, and before we take questions, anybody on the panel have any other proactive things they want to talk about? Okay. All right. Again, late this afternoon, the Dallas County issued an amendment to their order, and shortly thereafter, myself, as the mayor of the City of Rowlett, issued an amendment to my order, which calls for the following actions: prohibiting community gatherings of 50 persons or more. Community gatherings include indoor or outdoor events in a single room or other single confined or enclosed space, such as an auditorium, theater, stadium, arena or event center, gym, meeting hall, or conference center. Further, mandating that restaurants with or without drive-in or drive-through services in microbreweries, microdistilleries, or wineries may only provide takeout, delivery, or drive-through services. Additionally, bars, lounges, taverns, arcades, and private clubs shall close. If someone has tested positive in your household for coronavirus, the household is ordered to isolate at home. Members of the household cannot go to work, school, or any other community function. Nursing homes, retirement homes, and long-term care facilities are instructed to prohibit non-essential visitors from accessing their facilities unless to provide critical assistance or for end-of-life visitation. These orders are effective 11:59 p.m. tonight and will extend until 11 a.m. March 20th, which is Friday of this week. The Rowlett City Council will be considering how we will be extending that order past March 20th at tomorrow night's City Council meeting. This order by the City of Rowlett specifically means we will, as of 11:59 tonight, be closing the Rowlett Community Center, the Rowlett Public Library, the park called Kids Kingdom. Other parks will remain open. Please practice your social distancing. And in addition, all city athletic leagues will be postponed, and in-dining for restaurants and bars will no longer be allowed. So with that, I think I will see, Denise, where shall we go? You have questions? Okay. So as of right now, this does not affect daycares. Do I have that right?
I believe so.
Okay. Right now, this order does not prohibit daycare. Daycares are going to stay open and must follow the state guidelines.
They also are asking about churches.
This absolutely applies to churches. This means that there will not be allowed social or community gatherings of 50 or more people in one enclosed room.
And could you repeat the information about the Stafford Act? Several folks didn't quite get their
Okay.
Okay, and Denise is not on a microphone, so repeat. No, you're good. So repeat Denise's question and then.
So the question was to just provide a little more clarification regarding the Stafford Act. The Stafford Act allows the president to do one of two things, either an emergency declaration ahead of a request from a state governor to bring in FEMA resources, federal resources, and also if at the request of a state assistance is requested, the president may declare that a presidential disaster declaration in order to provide that assistance. So the emergency declaration just allows the president to take certain actions that free up federal resources to state and local governments and take any other actions that help create a more efficient and effective response.
Okay, thank you.
Can you repeat that phone number?
And repeat the phone number, Ed, and tell us again when they call that phone number and for what reasons.
So if you are concerned that you may have been exposed to COVID-19 or you may be showing symptoms of COVID-19, we do not recommend that you go to your primary care physician's office or the ER. Instead, we would like for you to go through a screening process. In order to do that, you can call this number for Parkland Hospital's COVID-19 patient line. That number is 214-590-8060. They'll take a look at your entire profile, including symptoms. So you do have to be symptomatic before they will perform a test. And you do have to have some sort of high-risk scenario, whether you're living at home with somebody who does have COVID-19, maybe you're a healthcare worker or first responder. You have to have some sort of higher level risk in order for them to push you to that process to get tested. So if you do show up to that location seeking to get tested without having gone through the screening process, you will not be tested.
Thank you. Yes, he did. You're good.
Several folks have more questions about daycares. Why
Okay.
do it differently apply to them if there's more than 50 kids in the daycare?
Well, what you should do, I mean, there's provisions on how schools can still operate, even though there's more than 50 kids in a school, okay? So, malls can stay open because they're practicing social distancing. So you got to look towards what those provisions are in regards to allowing that. Now, schools are closing because they're choosing to, not because, necessarily up to this point in time. This afternoon's order kind of changed things, but not because the Dallas County was requiring them to or the state was requiring them to. So I know that daycares have been a big topic of discussion among state officials and county officials, and I know they don't quite have that all tied down yet in regards to figuring out all those details, but right now they are not a prohibited organization. Do you all want to add anything to that?
I am aware that Texas Health and Human Services had passed some guidelines. I just glanced over them a little bit this afternoon, that they were requiring that only staff and essential people be inside the daycare. Parents are just supposed to be dropping off and picking up outside of the facility, and there need to be screening everybody that comes into the facility for fever.
And how does that 50-person or less requirement extend to daycares? Do you know?
The mass gathering policy that I was aware of, schools were exempt from
Right.
that.
So daycares are
Yes.
following that provision. And, I was gonna talk about that a little bit. Give me just a minute. I want to read from our order and the Dallas County order, and this may clear it up a little bit. For purposes of clarity, community gathering does not include the following: so long as persons are generally not within 6 feet of one another for extended periods. Spaces where 50 or more persons may be in transit or waiting for transit, such as airports, bus stations, or terminals. Office space, schools, or residential buildings. Grocery stores, shopping malls, or other retail establishments. But it obviously excludes the restaurants that we already talked about. Hospitals and medical facilities. In all such settings, the county is recommending following the social distancing recommendations, practicing personal hygiene measures that have been outlined. So those are the exceptions. So daycares would fall under that.
That's all the questions.
Okay?
But there was quite a bit of input about asking the community to please support restaurants by
Thank you, and I appreciate that. So Denise said there was quite a bit of input, and I did want to mention this. Very, very, very important that we continue supporting our local businesses and our local restaurants. Restaurants don't have to close. Restaurants have to close their dining in the restaurant itself. They can provide drive-through, they can provide drive-up, they can provide curbside, they can provide takeout, they can provide delivery services. Very, very, very important that we continue to support our local businesses and our local restaurants. And I know that our chamber president is here, and Michael Gallups, and he's very aware of all these regulations and is going to be working hard within our community to identify those facilities that are providing those services and those curbside and takeout services, and that information will be available on Rowlett's Chamber's website. Is that correct? He's doing this to me in the back of the room. Website, Facebook. So thank you for that reminder. I appreciate that. So are you seeing anything else, Denise? All right. So Okay. So I think I'm going to have some closing remarks, and then I'm going to ask Landon to come forward while I'm preparing these closing remarks, and he's going to conclude us in prayer because we think that's important right now. So just some closing remarks from me personally and from the city. We need to stay calm. Don't panic. We'll get through this together. We've done this before. We'll do it again. We're doing this for the right reasons. We're doing this so we can get past this. Shop local, if at all possible. Be kind in everything you do. Help your neighbors, and please help those at risk. Please don't hoard supplies. Please buy what you need and leave what you don't for others. Stay home and isolate if you're sick. Don't hoard PPE, personal protective equipment, if it's not called for you to be wearing it. We didn't talk much about that, but there's lots of guidance out there. You don't wear a mask to prevent yourself from getting sick unless you have somebody in your home that is sick. The masks need to be reserved for medical personnel and emergency personnel, and for those that are sick. Self-quarantine, please, if you've been exposed to someone with COVID-19 or if you've traveled in a high-risk area. If you suspect you have COVID-19, follow all those guidelines that Ed talked about tonight. Please stay up to date with accurate information, but don't overdo it. Don't listen to this stuff 24/7. Your mental health is important. So you need to get the information, you need to get the facts, you need to be aware of what's going on, but you also need to make sure your mental health stays strong. Please don't post inaccurate information on social media. Please don't make fun of this situation on social media. Please don't spread rumors on social media. Please don't create hysteria on social media. That causes problems for all of our residents in the entire community, and it doesn't help any situation. Please don't feed the frenzy. Don't politicize this. This isn't a political issue. This isn't about politics. This is about people. So please, if you're doing that, stop making this about politics. And this is my own personal plea, and I say this often, please give people the benefit of the doubt. People are making really, really, really difficult decisions right now, and they're making them for the benefit of our entire country, our entire region, our entire city, and they're making them with information. They're making those decisions with facts. It's fact-based decision-making, so please give people the benefit of the doubt when they're making those decisions. Obviously, limit your exposure to crowds and practice social distancing, but please go outside. Fresh air is really good for you. Walk your dog, exercise safely. Go to our parks if you practice social distancing and you practice hygiene. It's good to be outside right now. And please make sure we are all taking personal responsibility to get our community, our region, our state, and our country through this unprecedented event in our history. We'll get through this together, Rowlett. We'll pull together as a community, and we will help our neighbors as we're doing it. So I'm going to ask Landon Huey with 19 Ministries to please close in prayer with us for our community. You can go ahead and take my seat, Landon.
Thank you, Mayor and city leaders. Let's pray. God, we thank you for our leadership that we have here in the city, for our mayor, our city council, our city leaders. We pray for wisdom and guidance, God, that you'll lead them, Father. This was a surprise to us, but it's not a surprise to you. We pray, God, for your peace to invade every house across the city, God. And we thank you, Father, for being with us. God, watch over our first responders, our firefighters, our medics, our doctors, and our nurses, God. We pray for healing across the city. In your name, amen. Thank you.
Landon? I'm making him, are we still on, Drew? Drew, are we still on? Thank you, Landon, and thank you, Drew Rist, for helping us with this Facebook Live. Thank you, everybody, for listening in, whether you're live or you listen to this later. Please stay up to date with information. We will provide that information on an ongoing basis for the city. This changes very, very quickly, so please stay tuned to us. Good evening and be safe. Thank you.